Before we do anything else today, I need you to take a quick test with me. 60 seconds, no equipment, no standing up. You do not even need a pen. You are starting with a perfect score of 5. I am going to describe 5 things your body may or may not be doing right now. For everyone that applies to you, subtract 1 point. Be honest, your body already knows the truth. Question 1. When you wake up in the morning and take your first steps, do your feet feel stiff or numb for the first few minutes, like they need convincing to start the day? Not painful necessarily, just reluctant, slow to come alive. If yes, subtract 1 point. Those stiff minutes are not a normal part of aging that you simply have to accept. They are your circulation's overnight report card. Your legs have been completely still for 7 or 8 hours. No muscle movement, no pump. Blood has been quietly pooling and settling in your lower legs all night. Healthy circulation recovers within seconds of your first steps. Circulation that is struggling takes minutes. Those minutes are a measurement. Question 2. By the end of a normal day, not after a long walk, not after unusual activity, just after an ordinary day of sitting and light movement, do your legs feel noticeably heavier than they did this morning? Maybe your socks are leaving deep marks on your ankles when you take them off in the evening. Maybe your shoes feel tighter at 5 o'clock than they did at 9. Maybe you sit down at night and your legs feel like they are carrying something extra that was not there when you woke up. If any of that is familiar, subtract 1 point. Question 3. Have you been jolted awake by a leg cramp in the last 3 months? Not a mild tightness, a genuine spasm, the kind that makes you gasp and reach for your calf in the dark, the kind that takes a full minute to release. If yes, -1. Muscles that are receiving adequate oxygen do not cramp like that. They relax, they recover. A muscle that seizes violently in the night is a muscle that has been sitting in low oxygen blood for hours, and oxygen travels in your blood. Question 4. When you sit for more than 40 minutes watching television, reading, sitting at the table, do you feel a restlessness in your lower legs that you cannot quite name? An urge to move them, shift them, cross them, stretch them? Something uncomfortable that is not pain, not tiredness, just an insistent need to change position? If yes, subtract 1 point. Most people dismiss this as impatience or habit. It is neither. It is your nervous system detecting falling oxygen levels in your leg tissue and sending a movement signal. Your body is trying to restart its own circulation. The discomfort is a biological alarm and it is working exactly as designed. The problem is not the alarm, the problem is what triggered it. Question 5. Look at your lower legs right now. Do you see any blue or purple spider veins that were not there a few years ago? Any ropey raised veins that have appeared or visibly worsened recently? If yes, subtract your final point. These are not a cosmetic issue. They are a pressure issue. Veins become visible through the skin when the pressure inside them is consistently higher than it should be. When blood is not moving upward efficiently, it backs up. The vein walls stretch under the accumulated pressure and become visible. What you are seeing on the surface is a valve beneath it that is weakened. Now count what you have left. If you scored 5, your circulation is genuinely strong for your age. What I am about to show you will protect it and keep it that way. Do not skip it because your number is high. If you scored 3 or 4, your body is sending early signals, not emergency signals, early ones. And early is precisely when intervention is most effective. You are in the best possible position to act. Pay close attention today. If you scored 2 or below, I want you to hear this directly from me. Do not feel discouraged. Feel focused. The lower your number, the more dramatically your body will respond to what I am about to show you. I have worked with patients who came in with scores of 0 and transformed their circulation in under 3 weeks through nothing more complicated than what we are doing in this video today. Pause right now and write your score in the comments below. Not for me, for you. Because in 21 days, you are coming back to this video and taking this test again. And when you do, I want you to see exactly how far your body has traveled from today. Your day 1 number is important. Your memory will not keep it as accurately as a comment will. Write it down. Your heart pushes blood down to your legs easily, getting it back up against gravity. That is where the system is tested. Inside your leg veins, there are dozens of tiny one-way valves. Imagine trap doors installed at intervals along a pipe. Each one opens to let blood through going upward, then snaps shut to stop it falling back. Valve by valve, blood climbs from your ankle to your heart. Now here is where age enters the picture. Those valves weaken with time, the seal loosens, blood begins trickling backward between heartbeats and pooling in the lower leg. That pooling is the root cause of every symptom you just identified in that test. But the valve system is not your body's only mechanism for moving blood upward. There is a second pump, and unlike the valves, this one you control completely. Every leg muscle, when it contracts, squeezes the veins running through it. Each squeeze forces blood upward. The muscle relaxes. The valves hold it in place. The next contraction pushes it higher. Your leg muscles are a mechanical pump working in parallel with your heart. Cardiologists call your calf the peripheral heart because that is exactly what it is. When you sit still, that pump stops. The valves are working alone. And in aging veins, the valves are already struggling. Circulation in your lower legs drops sharply within 30 minutes of sitting. Because this pump is muscular, you can restart it deliberately without standing, without equipment, in any chair. That is what the next 4 exercises do. And stay with me after the exercises because I have 3 clinical strategies to share, including one evening habit that is silently damaging your veins while you sit watching television tonight. Almost everyone does it. Almost no one connects it to their circulation. Exercise 4, the ankle clock. We begin here because this mobilizes the ankle joint before we ask the muscles to work. The ankle is surrounded by dense blood vessels and lymphatic channels. When it has been still for hours, those channels compress, the joint stiffens, and a stiff ankle reduces the range available to your calf muscle, making every exercise that follows less effective. Think of it as unlocking the gate before pushing water through the pipe. Sit tall. Lift your right foot 1 or 2 inches off the floor. Now draw a clock face with your toes. 12 soon, 3, 6, 9, back to 12. Large, slow, smooth circles. 5 clockwise, 5 counterclockwise. Switch legs. Movement from the ankle only, not the knee or hip. If you feel a faint clicking at one point in the rotation, move through it gently. That is exactly where the work is needed most. By the end of 90 seconds, your ankles will feel noticeably looser and warmer. That is blood returning to tissue that had been compressed and still for hours. The foundation is set. Now, exercise 3. Exercise 3, the seated heel march. The thigh contains some of the largest veins in your body. The femoral vein runs its full length and carries enormous blood volume every minute. When you sit, the weight of your thigh on the chair partially compresses that vein. Getting the thigh muscles working reopens it. Sit with your spine self-supported away from the back of the chair. Feet flat, shoulder width apart. Lift your right heel off the floor. Keep your toes and the ball of your foot planted. Hold 3 seconds. Lower slowly. If your heel drops, you have lost half the exercise. Left heel up, 3 seconds. Lower. Right heel up, 3 seconds. Lower. 1 lift every 4 to 5 seconds. Slow and controlled. Now the detail that makes this significantly more powerful. As your right heel rises, press your left foot firmly into the floor simultaneously. 1 leg lifting, 1 leg pressing. Both legs working at once. This is a bilateral tension pattern. It doubles the muscular activation and increases blood movement through the entire lower body, not just the working leg. 90 seconds, 20 lifts per leg. Within the first minute, you will feel warmth spreading through your thighs. That is fresh, oxygenated blood arriving. The pump has restarted. Before exercise 2, a number that stopped me cold when I first read this research. Scientists measured blood flow in the main vein behind the knee during normal sitting. After 90 minutes, flow had dropped to less than 40% of baseline in people with no diagnosed vein conditions, just people sitting at a desk, less than 40%. And the same study found that 25 seconds of calf activation restored flow to near baseline levels, not 25 minutes, seconds, 25 seconds. Hold that number because the next 2 exercises target exactly that mechanism and they are more powerful than they look. Exercise 2, the full leg extension pump. This flushes 3 separate vein systems in one single movement. Feet flat, working 1 leg at a time. Phase 1. Slowly straighten your right leg forward until roughly parallel with the floor. Take 3 full seconds. Your quadriceps wrap around the femoral vein and squeeze blood upward. Thigh flush. Phase 2. At full extension, point your toes forward and down as far as they will go. Hold 2 seconds. Your calf muscles compress the deep veins of the lower leg. Calf flush. Phase 3. Now pull your toes back toward your shin as hard as you can. Hold 2 seconds. The muscles along your shin contract. The veins along the front of your lower leg are cleared. Complete lower leg flush. Phase 4. Bend the knee slowly and return your foot to the floor over 3 seconds. The muscles release. The veins refill with fresh blood. The valves hold everything in place. Ankle to hip, 1 movement, 10 seconds. 3 vein systems flushed. 10 repetitions on the right, 10 on the left. During phase 2, you will feel a deep tightening inside the calf, not on the surface, but in the muscle belly. That is your soleus compressing the deepest veins. That deep engagement is exactly what you are looking for. If the knee is uncomfortable, extend only part way. The toe point is the critical phase regardless. Before exercise 1, please hit the like button right now. It gets this video in front of someone sitting with swollen ankles and nighttime cramps who does not yet know a solution this simple exists. You might be the reason they find it today. Thank you. Now, number 1, exercise 1, the deep vein reset. I call this the deep vein reset. Everything before this was preparation. This is the intervention. Your calf, fully contracted, pushes blood upward with the force of slow walking. Cardiologists call it the peripheral heart because that is exactly what it is. A genuine mechanical pump that moves real blood volume with every single contraction. Most people get partial contraction, partial effort, partial result. Here is how to get the full contraction. Sit tall, feet flat, hip width apart. Before you lift, press the balls of your feet into the floor. Feel the floor pushing back. Hold that ground contact. That anchor is what makes this a pump, not just a stretch. Now, keeping the balls of your feet pressed down, raise both heels as high as they will go. Not comfortably high as possible. At the top, squeeze. Actively squeeze your calves as hard as you can. 1 second, 2, 3. Now lower your heels slowly. 3 full seconds down all the way until your heels touch the floor before the next repetition. That slow lowering produces nearly as much circulatory benefit as the lift itself. Most people drop their heel in half a second and lose most of it. 3 seconds down every repetition. 10 repetitions, rest 30 seconds. 10 more. Now the single leg version, left foot flat on the floor, right heel only. Same anchor, same height, same squeeze, same slow lowering. 8 repetitions, switch. Single leg activation doubles the contraction force in each calf. You will feel the difference immediately. Around repetition 6 or 7, you may feel a burn in your calves. That is lactic acid. It means the muscle is working hard enough to make a real difference. That burn is not a warning, it is confirmation. Do the deep vein reset twice daily, morning and evening. And anytime you have been sitting more than 30 minutes, 10 double heel raises, 25 seconds. That is your circulation reset. Here is the complete plan. Morning before your first coffee, ankle clock 90 seconds. Seated heel, march 90 seconds. Full leg extension pump 10 reps each leg. Deep vein reset. 2 sets of 10 plus 8 single leg each side. Total 7 minutes. Evening between 4 and 7. Repeat the same sequence. Afternoon timing is deliberate. Fluid has been accumulating in your legs all day. If you do 1 session only, do it then. You will feel the difference by bedtime. Throughout the day, 10 double heel raises every 30 minutes of sitting. One clinical note, do not do these exercises within 60 minutes of bedtime. The fluid they mobilize will reach your bladder before morning. Finish your evening session before 7. Now, the 3 bonus strategies I promised. Bonus 1, the morning glass protocol. Your blood thickens when you are dehydrated. After 7 or 8 hours of sleep with no fluid intake, it is at its thickest point of the entire day. Most people respond to this by making coffee, which is mildly diuretic. They are thickening blood that is already at its thickest. During the window, it needs to flow most freely. Here is what I tell my patients instead. Before anything else, before coffee within the first 10 minutes of waking, drink 1 large glass of water, 300 milliliters. This single habit measurably reduces morning blood viscosity. You are thinning your own blood before the day begins. Then drink steadily through the morning. Small amounts regularly, not large amounts infrequently. Aim to have most of your daily fluid consumed by 2 in the afternoon. Then taper off toward evening to protect your sleep. This is called hydration front-loading. Simple done consistently beats complex done occasionally every time. Bonus 2, the nitric oxide foods. Your vessel walls produce a molecule called nitric oxide. When it is present, vessels relax and widen. Blood flows through a broader channel with less resistance. Circulation improves throughout the entire system. Production declines with age, but certain foods restore it directly. Through dietary nitrates, your body converts into nitric oxide in 2 biological steps. 3 foods supported by consistent clinical research. Beetroot, the most potent dietary source known. 2 to 3 servings per week produces measurable improvements in blood flow velocity. Roast it, add it to salads, or juice it. If the taste bothers you, mix with cold apple juice and a squeeze of lemon. The taste disappears, the benefit does not. Dark leafy greens, spinach, rocket, watercress. A daily handful in any form you enjoy. Dark chocolate above 70% cocoa. The flavonoids directly stimulate nitric oxide production in vessel walls. 2 or 3 small squares daily. That is your prescription. Bonus 3. The habit damaging your veins. Tonight, notice whether you are doing this right now as I describe it, crossing your legs at the knee. When you place one knee over the other, you compress the popliteal vein, the main drainage vein behind the bottom knee, the same vein from the research, the one that showed 40% flow reduction after 90 minutes of sitting. You are placing a partial clamp on your leg's main drainage highway. Most people do this every evening, exactly when venous pressure is already at its daily peak. One change fixes it entirely. Cross at the ankle instead of the knee. Ankle crossing applies no meaningful compression to any major vein. Same postural comfort, 0 circulatory cost. When you catch yourself crossing at the knee, uncross. Feet flat for a few minutes, then ankle over ankle. Within 2 weeks, the habit shifts. Every patient I have shared this with tells me the same thing. We started today with a number. That number is not a verdict, it is a starting line. I have seen patients arrive with chronically swollen ankles, relentless nighttime cramps, and visible varicose veins across both legs, and make genuine significant improvements through nothing more than consistent daily movement and a handful of specific changes. Not surgery, not medication, consistency. What your legs need is not complicated. 7 minutes in the morning, 7 minutes in the afternoon, 10 heel raises every 30 minutes, a glass of water before your first coffee, beats twice a week, 2 squares of dark chocolate, feet flat in the evening instead of crossed at the knee. That is the entire prescription. Do it every day for 21 days. By day 21, the habit drives itself. Your legs will remind you, not the other way around. On day 21, come back to the beginning of this video, take the test again, then come to the comments and tell me what happened. Write something like, day 1 I scored 2, day 21 I scored 4, the sock marks were gone by week 2. Whatever your truth is, write it. Someone sitting where you are sitting right now needs to read it more than they need anything else I could say. If this helped you, share it with one person who complains about heavy legs or swollen ankles. Subscribe if you are not yet with us. Every week, no supplements, no equipment, just science you can use. Your legs have carried every version of you that has ever existed, every step, every decade, every hard year, and they were there. It is a small thing to give them 7 minutes of yours.